Navigating Brain and Spine Tumor Care Through Telehealth, presented by the Neuro-oncology Branch, National Cancer Institute, and Wilmot Cancer Institute, University of Rochester.
I would like to start the presentation by trying to go through a definition of what telehealth is. I really like this one from the National Consortium of Telehealth Resource Centers. It defines it as a collection of means or methods for enhancing healthcare, public health, and health education delivery, and support using telecommunication technologies. One of the interesting things about this definition that I really like is that it doesn't exclusively refer to patient care, because as we will see a little bit later, telehealth can be very useful for many things, among which is physician-patient interaction. You can think about it as a set of tools and technologies to deliver virtual health. Despite being a very useful and important tool, it is a tool that enhances patient care and does not completely replace the face-to-face contact between people. It has become very important and experienced very rapid changes due to the current situation that we're living. And we thought that it would be an interesting and important topic to share with people. As implied in the original definition, when talking about patient to physician interaction, there are many ways that this can happen. The most conventional one that people um, relate to telehealth is the video conferencing. This is the one that most closely resembles the direct interaction that happens in a medical office. But this is not the only way that the telehealth can happen. You can also have recorded visits in other providers or practitioner sites for review at other places, or you can record the messages and send them to your doctor's office where they can be reviewed. One aspect of telehealth that has been used for a while very successfully is the one of remote patient monitoring. It is currently being used to monitor cardiac, epilepsy, and sleep disorders in the patient's home. The last topic on this slide, the topic of mobile health, is the one that has expanded most rapidly recently with the improvement in the technologies used for mobile communications. This has also brought new sets of problems, but I think that this has really expanded the ability of people to provide telehealth services. Just like with anything else, including tools and technologies, telehealth can have its own advantages and disadvantages. This is just a small list of pros and cons of using this set of tools, but it is by no means all inclusive. Among the advantages of using telehealth, there is the obvious convenience for patients and providers. You can have visits from your home without having to go to any medical center and deal with parking and all the difficulties that can happen when you have to head that way. And providers can work without having to move between offices or from the comfort of their own homes. In general, it saves money because the charges associated with telehealth visits are lower than they are when the actual physical visit happens in an office. And because of the ability to remove the need for geographical relocation, access to specialists and unique services is increased. And this is one aspect that is very important for people who are dealing with brain tumors, since there are very few specialized centers for brain tumors throughout the world. It also improves patient engagement because you may be able to interact more frequently with your doctor and in a more personal way than just by phone calls. And so this is very important for people who live with chronic diseases and conditions. Not everything is perfect with telehealth, and obviously we can see that there are some disadvantages of using the technology. When you do both physical visits and telehealth visits, because of the increased number of interactions, there can be some increase in the cost of the healthcare delivery. And then there are obviously technology barriers that need to be overcome from both the provider and the patient. Insurance coverage has been a gray area until now. And then one of the largest limitations of using telehealth is that we cannot do a conventional physical exam, which is a very important tool that we rely on to make a lot of the clinical decision making. Telehealth has experienced a lot of changes in the past 2 to 3 months. I really like to point out some important changes from the Centers of Medicare and Medicaid um, with and the adjustment to their policies that have happened. There are now no geographical restrictions to the delivery of telehealth services. So, meaning that services can be provided from any physical place and the patient can be on any physical place. In general, you need to have live video as part of the encounter for this to be considered telehealth, with very few exceptions, such as counseling or delivery of mental health care. The frequency limitations have been lifted temporarily. So if you need to interact via telehealth with your doctor's office every day, if necessary, you can do that. And then there was a requirement that providers be licensed in the patient's home state. This has also been lifted. So it makes it now possible for you to access to other places in other states to help with your care. One aspect that is important for people living with chronic conditions is that the restrictions on face to face contact, meaning being in the doctor's office to get controlled prescriptions, have been temporarily lifted. There are important implications, and I'll go over a couple of important things that need to be considered when doing telehealth encounters. One of them being the financial implications. Any encounter that you do using telehealth, is a patient to provider interaction that should be treated just like an office visit. As I mentioned before, coverage depends on your insurance. And then, depending on how much time you spend and how complex the visit is, your insurance will be billed and you will be responsible for some financial charges. In general, telehealth visits are less complex than regular visits, so the charges associated with them are usually lower. But it's very important to check with your insurance company before you go on telehealth visits. Another important aspect about telehealth encounters is protection of your privacy. Um, just like communicating using a phone or video conferencing in real life, when you're doing telehealth encounters, there's the possibility that whatever you're saying or whatever you're doing may be accessed by people that you don't want to access this. Um, there are specific rules on how these encounters are to be conducted, but this has somewhat been relaxed. And the Department of Health and Human Services has allowed communication using more conventional platforms as long as they have what's called end to end encryption to protect your privacy. One important aspect of all this is that any tools or platforms that are public facing, such as YouTube or TikTok, cannot be used for these encounters. Most providers or most offices will pick a platform that fulfills all the federal requirements. But I also think that it's very important that you do your due diligence and do whatever you can to protect your privacy.
In conclusion, you can effectively receive care using telemedicine. Benefits include convenience, improving access to specialists, and cost savings. The limitations include technology barriers and that it cannot completely replace in-person visits. In addition, telehealth services are changing rapidly. Check with your doctor about available options. Check with your insurance about coverage before your visit. Your provider will choose a secure platform to protect your privacy. How to prepare for a telehealth visit.
It is important to go through a sort of checklist of things that you may need to do before interacting with the medical offices. Most practices will guide you through some of the things that you need to do. and they very likely will request some information from you beforehand. It is very helpful, just like with regular clinic visits, to provide as much of the medical information, imaging, and pathology specimens beforehand. And I think that this will only make the person who's going to see you able to provide better care. One of the first things to do while preparing for a visit like this is to test out the equipment. It is important to make sure that you can operate the camera, microphone, speakers, or headphones that you're going to use during the visit. It is also important to make sure that the image and the audio quality are adequate for the encounter. Many people conduct these encounters using mobile devices, so it is important to have the device connected to a power source and charged, since continuous audio and video conferencing can drain batteries very fast. Whenever possible, communication is better using a wired internet connection, but depending on the device you're using, this may or may not be possible. When using computers, it is very important to close all unnecessary programs, since this can affect the quality of the video or the audio that comes in and out of your device, making the visit more difficult. You need to find a place that is well lit and where you have some room and adjustable lighting so that the visit can be held in a comfortable way. And if you're asked to do some things, you're able to. Um, you should collect all the information that you need beforehand so that you don't have to move around finding medication lists and other pieces of information. And then, just like when you come to a clinic visit, we ask people to have the medication list as well as doses and frequency with them, so that you can provide them when asked about them. Once the visit starts, it is important for you to become familiar with how to operate the software. And as I mentioned before, there are many different platforms that you can use, but in general, they all share in common the ability to share audio, video, and some files. It is important to know how to operate the software and turn the video and audio off, as well as move the device in case you need to. You may be asked to walk and perform maneuvers, and so make sure that you have enough room. And then it is very helpful to have another person with you who can help with some of the maneuvers. Because friends and family can join in, it is important to make sure that they're available and connected during the visit. This is something that is best done beforehand. One of the nicest things about using tools like this is that you can have as many people as you want in the clinic visit, and they can join in from pretty much anywhere in the world. Finally, you should consider this just like any clinic visit, and it is important to remain engaged and avoid being distracted so you're able to remember the discussion that you have with your provider, and you're able to understand the instructions. So if you have any questions, you're able to ask them at the time that you're there during the visit.
In conclusion, check your equipment beforehand. Have your doctor's office phone number available if you have a technical issue. Find a place with adjustable lighting and room to move. You may need to stand, walk, or raise your arms. Invite a family member or friend to join. Have your list of medications and questions ready. What does telehealth look like?
Televideo visits have emerged as an innovative and a practical way to provide care to patients with brain tumors. And today I'm going to talk about what telehealth looks like and what a televideo visit looks like. So first and foremost, a televideo visit is similar to an in-person visit in that it starts with a conversation. This is a time for physicians and providers to take a history from patients. We discuss new symptoms or changes in symptoms. We may discuss any updates since the last visit. It's a time for us to go through medications and a medication list. So having a list ready can be very helpful for these visits, and also having medications nearby can be helpful in case the physician needs to actually look at the bottle. It's also an important time to maintain a connection that we've made with a patient that we already know, or to establish a connection with a new patient. And we have found over the past few months that we've been able to have even some of the very difficult conversations about a new diagnosis or a challenging tumor to treat. And we've been able to make those connections with family and with the patients, even through these video screens. And a televideo visit is also a time to ask questions about your condition, to address any concerns that you have about your care. And it's a time when physicians and providers would also be asking you questions or concerns that they have about your care. After we take a history, we typically move on to a medical examination, and there are several things that we can do really well in a medical examination. A big part of what we do is we observe. We look at what we see on a patient, and we can still do this through video. For example, we can take a look at a rash that you might have developed. We can look in your mouth with a camera for a fungal infection such as thrush. We can look at a surgical scar from after surgery, and we can look at areas of swelling. So if a patient has a swollen calf, we can look at that and assess whether we think that might be a blood clot. We can assess cognition. We do tests that are all verbal to be able to assess what your memory is like, whether you can maintain attention to things, how a patient's concentration is, and we can assess language by testing a patient's ability to name things, repeat things, or to understand things. And then when we get to the neurological exam, there are some components that we can continue to do well, and we can assess a lot of different brain functions. So by looking at eye movements and whether a patient has facial weakness or their tongue position, we can assess an area of the brain called the brainstem. We can look and see whether strength is symmetric across the body, whether both arms and both legs can do similar activities. We can assess walking, and walking really gives us insight into a lot of different functions of the brain by how you walk, how coordinated that is, whether there's any problems with imbalance. There are some things that we have more difficulty with. Hearing and vision can be very difficult to test. We can't look inside your ear through a televisit right now. We also have a hard time looking closely at your pupils or looking into your eyes with more complicated testing. We have difficulty listening to one's heart and lungs. We have trouble more specifically assessing weakness. And so if someone's weakness has gotten worse since the last visit, we can't feel the extent of that compared to the previous visit. We can't pull out our reflex hammer and check your reflexes through a video visit. And we have a difficult time assessing sensation, which we'll usually do with a pin or by checking your sense to temperature. And we also have trouble with anything where we have to actually touch the patient. And so things like feeling lymph nodes or feeling a new area of swelling or feeling a patient's stomach are things that are difficult. This visit is a good opportunity for us to share information, and we can use the televideo platforms to be able to do that pretty effectively. So we can share our screen and show a patient their MRI or their previous MRI and look at specific aspects of the tumor together. We can share laboratory values that we might be concerned about and pull up a patient's entire lab report. We can pull up a pathology report and discuss any specifics related to molecular markers on that. And we can also pull up instructions or information that's important for your care. And so if we're thinking about putting you on a new medication, we can pull up a list of medication side effects. If we're writing out a steroid taper or putting you on a new seizure medicine, we can write out a schedule for that and make sure that that makes sense. And we can do that on a screen so you can see exactly what we're writing as well. If we have dietary recommendations or exercise recommendations, we can write that out in the instructions so that you can see exactly what we're writing and we know that it all makes sense to you. There are also things that you can share. You can share documents from a clinical trial that you might have found out about so that we can look at that together. If there's a therapy you read about on a blog or a new drug or some alternative treatment, you can pull that up so we can see exactly what you're talking about as well. There are some ways to optimize the visit. It's important that just in any telemedicine visit, like you would in an in-person visit, that you be honest about your interactions. So if you're having problems with the technical parts of this, if you have trouble hearing, if you have trouble seeing, if looking at the multiple screens is difficult for you, that's something that you need to be honest with your physician about. There are times where we can troubleshoot and adjust things to improve that. And there are times where we might decide that doing the visit by video just isn't working. Like any other visit, you should be sharing your questions and your concerns and feel comfortable in having conversations about even intimate things or difficult things. And this is an opportunity for you to include your entire team in the visit. We've seen patients who've brought in family members from all over the world onto these visits. And we also include our entire team on these visits. So it's a chance for us to include our advanced practice providers, our nurse, our pharmacist. Sometimes we'll have the neuro-oncologist and the neurosurgeon on the visit together so that we can provide the best possible care. At the end of your visit, it's important for a patient to ask all of their questions and make sure that all of their questions are answered. There are ways to make sure that you understand the plan going forward. So in an in-person visit, we might print out a calendar for a chemotherapy regimen, or we might print out instructions. So it's important to know how you're going to get that information. Is that something that might be sent to you through the electronic medical record? Is that something that might be sent to you by email? Or is that something that you would prefer to get a printed copy of sent to your house? And then finally, it's important to understand how the next steps will be arranged. We don't have a front desk for you to go to set up the next appointment. So will someone call you for that appointment or for those referrals or MRIs? Or is that something that you need to pursue yourself?
In conclusion, telehealth is a conversation with your doctor. Your doctor can perform certain medical exams by video and share data and information. Optimize your visit by being prepared, asking questions, and including your care team. Telehealth and clinical trials.
Clinical trials are an important part of brain tumor care, and telehealth has the ability to change how we do much of this. In the traditional way of looking for clinical trials, we'll often have patients searching for a clinical trial online or through word of mouth or from hearing something from a family member. They'll often then identify clinical trial sites that they may want to consider. The next step will typically be a phone call or an email to that site, either by the patient or by the physician. And then after that, if they feel like something is going to work out, they'll go for a visit to that site. If everything works out and the patient finds a trial that works for them and that they're eligible for, they can go ahead and enroll on that study. But often at that visit, patients find that they're not eligible for various reasons, that the trial may not be the right fit for them, that they don't want to do the travel back and forth, or that there are too many visits or too many side effects that they're worried about. And if that trial is not the right fit, then they have to go back to the beginning to identify another clinical trial. And often that results in delayed time and then having to visit another place, which can result in extra cost. We do believe that in the near future, we can really streamline this process with televisits. So now after a patient searches for a clinical trial, they can identify clinical trial sites, and they have the ability then to do telehealth visits with multiple programs at the same time. So they can assess different clinical trials, find out details about them, find out if they're eligible for them, meet the physicians who are part of those treatment teams, and then make a decision about the right trial for them. And once they do that, they can take the next step to travel and then enroll on the study. So we hope in this new paradigm that we'll be able to reduce the costs of travel and also to reduce the time it takes to find the right trial, particularly at a time that is very stressful for patients. Once a patient is on a clinical trial, there are some visits that still will need to do in person no matter what. These are things like drug infusions and injections, surgical procedures, radiation procedures, blood draws, tests like EKGs, or if there's other tests that need to be done to assess the safety of a drug, so things part of safety visits. But there are some elements of the clinical trial that can be done remotely. And so we can think about some clinical trial visits that can be done on televideo where we're getting a history, finding out if there's been any changes or new symptoms since the last visit, where we can do part of a neurological examination through a video visit, where we can really get details about the side effects that you might be having to a clinical trial drug, where we can go through drug diaries with the patient, and finally, where a patient can go through some of the patient-reported scales or quality of life measures that are often part of clinical trials. Some of these elements have already been incorporated into clinical trials, and we believe that this could be the near future for clinical trials to both improve access to these studies and then make being on these studies even easier for patients.
In conclusion, telehealth can improve access to clinical trials. And in the near future, telehealth could streamline the clinical trial process to save cost and time and make it easier for patients to be on clinical trials. Improving access to services.
I'd like to talk a little bit about how telehealth is improving access to some services for our patients, and also a little bit about some of the limitations and the benefits that we've encountered. So, patients with brain tumors will typically be cared for by not just one person, but a care team. And that means that in addition to your primary doctor or neuro-oncologist, you'll often have additional team members. This may include a neurosurgeon, this may include a radiation oncologist, but also may include people from a variety of different specialties that may treat other symptoms that you may have. And additionally, there may also be people like social workers or nutritionists who play an important role for you. And one way that other specialists can play an important role in your care is through second opinions. So we know that our patients can benefit from having a second opinion at a tertiary care hospital. And there are common questions that our patients will have, which include, do other specialists agree with the treatment that my doctor has recommended? And am I a candidate for a specific clinical trial? And are there any promising new treatments on the horizon that I haven't heard about yet? And we really try to encourage people to get a second opinion so that they can be educated and feel comfortable with their treatment options. Additionally, patients with brain tumors will often have significant symptoms which can impact their quality of life. And these can include changes in vision and hearing, changes in cognition, seizures, weakness, and sometimes depression or anxiety, which can be related to the diagnosis, but also to what is going on in terms of the pathology. And team members, including physicians, social workers, and nutritionists, can work with them to help with their symptoms. And tertiary care centers often have a variety of specialists and supportive services to help with this. And as part of the care team, they can really help have a positive impact on the quality of life. Specialists can include specialists in tumor-related epilepsy, a cancer and cognition clinic, or a neuropsychologist, neuro-ophthalmology to manage any eye-related symptoms, palliative care, and they provide a variety of supportive services, but also can sometimes help direct patients as they are trying to figure out their goals of care and working with their other doctors, and psychiatry and psychology, and they can provide a lot of support for mental health. Additionally, supportive services from nutrition, social work, and integrative oncology can be very helpful. And integrative oncology services can include things like even massage therapy or cooking classes or small things that can really improve quality of life and really benefit the whole person. And some of these things can be provided remotely, although not all. There are a lot of barriers to having these extra visits, and that's one reason that telehealth is helping to bring down some of these barriers. Specialists tend to be in more urban areas. they tend to be concentrated in these big cities, and a lot of our patients are not in these big cities. Older patients may have difficulty with their mobility and may not have easy access to transportation. And patients in rural areas may have to travel long distances in order to reach us. Finally, patient time in clinic can be a major issue. So we often stack our visits one after the other to try and minimize travel for patients. And unfortunately, this sometimes results in long days at the hospital. And people feel very overloaded by the information that they've heard and also just by the sheer number of hours that they've spent seeing physicians. So sometimes those extra visits, even if they may be helpful, can seem like too much. So telehealth is in some ways helping us to break down those barriers. It can reduce time and expense of travel and improve access to some of these specialists, especially if there is someone who is not in your area who may be able to help something very specific. Additionally, it reduces that stacking of visits. So one thing that we've found with the increased use of telehealth is we have improved access to some of our specialists. For example, patients will be able to set up a visit, not having to add it on to all of their other visits with our specialist in tumor-related epilepsy. And I think the same thing is true for the cognition and cancer clinic that, I will be heading next year. And for telehealth services, we know that in addition to these second opinion consultations, we can have patient education, and it can also be useful for advanced care planning visits. And I wanted to specifically mention that because oftentimes I think there's a lot of worry on the part of providers and patients that these difficult conversations can be hard to have over telehealth. But we've really found that telehealth has given us the flexibility to add in these visits and have them early and have in-depth conversations and really make that connection. So it is possible to have a really good conversation via telehealth. And there are potential benefits to all of the different types of telehealth services that you can provide including having more family members involved and increased flexibility in scheduling. So, in conclusion, you can effectively receive care using telemedicine, and you have to be prepared, you have to know what to expect. But in many ways, it's a lot like a regular provider visit face to face. And potential benefits include improving access to clinical trials, receiving second opinions from places that are far away, seeing specialists in a variety of areas that may be able to help with symptoms, and also improved access to supportive services such as nutrition. However, it can't completely replace in person visits. There are a lot of services and a lot of treatments, such as radiation, some infusions, which still have to be done in person. And I think that there is something intangible about having that in person visit, and it's still very important to some patients. And so I think that it's never going to completely replace in-person visits, but I think it's going to be a very important adjunct.
For telehealth resources and information, visit cancer.gov/NCI-Connect, braintumor.org, urmc.rochester.edu/patients-families. U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov/NCI-Connect, 1-800-4-CANCER, produced June 2020.